Welcome back to N-Powerment Nursing. I'm Ashley and I'm a nurse educator, and you are tuning into our weekly application of In the Know, where we make it simple. And today we are applying a video that we recently shared about testing tips. So if you missed that, you can go back and watch the replay on our Facebook page or on our YouTube page. So how this works is that the question is posted above this video. I want you to comment what your answer would be in the comment section of this video, and then I'm going to let you know what the rationale to the right answer is. So our question is as follows. The patient with a chest tube is complaining of pain rated on a 7 on the pain scale from a 1 to a 10. Which intervention should the nurse implement first? So this is a prioritization question. So here's our options. A, check the patient's medication record, or MAR, to determine when the last pain medication was administered. B, assess the client's respiratory status and chest tube insertion site. C, document the client's pain complaint in the nurse's notes. Or D, call the respiratory therapist to assess the patient. So let's consider these one by one. We know that we have a patient that has a chest tube. They have pain on a 7 from a 1 to 10 scale, so that's pretty bad pain, I'd say. What are we going to do first? Meaning, what are we going to do right now? A, check the medication record to determine when the last pain medication was administered. That's not the right answer. Although we will do that in the event that we give them pain medication, we need to do something else first, because that's abandoning your patient, right? If you watched that video, you will know that you want to choose something that doesn't delay caring for the patient. So usually you're going to do something for the patient first. B, assess the client's respiratory status and their chest tube insertion site. That is actually our correct answer, but I'm still going to talk about C and D. C, why is this one incorrect? Document the client's pain complaint in the nurse's notes. That says you're basically just going to go write down that they have a pain at a 7 out of 10. You're not going to do anything. You don't document unless you're going to actually do an intervention, right? And D, call the respiratory therapist to assess the patient. D is incorrect because you're passing the buck. You are deferring responsibility onto respiratory therapy, and you're not doing anything for the patient. So you can see that B is the only possible answer where you're actually going to do something to help the patient's situation. So B, assess the client's respiratory status and chest tube insertion site, would be our correct answer. So for the answer to this question and more, and for all the concepts you require simplified for your registration exam, you can check out our complete study packages at www.npowermentnursing.com. We guarantee you will pass, or we will give you your money back. And we will see you next time. Thanks so much for joining me. Bye for now.